think one of the things that we do very well that certainly has taken a big weight off my shoulders, so to speak, is educating the value of cost of procedures. This is another thing that Emma identified very early on, is I'm not the person who should be talking about cost. And that's from a standard consult to an ECG to a flat skin graft on the face. My experience, my expertise is in clinical. That's where I need to be spending my time. That's a cancer. We're going to have to do this. I'll leave you with the nurse and they'll discuss with you the procedure and book in a time and give you the price. And that I don't have to worry about this awkwardness of how do I explain cost. That's not my forte. Now, some doctors are good at that and don't have an issue with it, and that's fine, but I'm certainly not one of those doctors. So again, if there is a sticking point that you find uncomfortable, similar to myself, like we've got you covered in the sense that if that's what you don't like doing, we want that off your desk. We want you working in your field of genius, in your zone of enjoyment, not doing things you don't like. And so, our staff are very well rehearsed, and so if they've been booked in for a half an hour procedure for a melanoma, requiring 30 millimetre diameter margins, that's all been costed and that's all been explained to the patient. And so when the patient rocks up, the financial consent has already been done. Okay, that's a big thing that I didn't realise was an irksome point. But again, even just in a consult, I will see someone, I will go overtime. There'll be this awkwardness where I might scale back the billing. Again, accountability, the reception staff will go, no, you've spent half an hour with the doctor, you're going to pay for a half an hour appointment. Again, they've got my back in the sense of Andrew's weak on that front. How do we help him to be the best that he can be? If he needs half an hour with that patient for that consult, that's what we're going to have to do. So again, all that is done, which takes the pressure off my cognitive part going, oh, how do I do this? So, my zone of genius should be, and as should be yours, in the clinical front. That's what we're here for. That's what we're serving the patient with, our clinical knowledge. It's not educating the value around the cost of the procedure or the booking in time or, how long this is going to take. So, my role, my professional advice is you need an ECG, you need that skin cancer cut out, you need that pap smear or the spirometry or whatever it is. Pass that on to the next person in their field of expertise, which generally would be either the nurse when it comes to clinical procedures, or maybe the receptionist when it comes to booking in appointments, and that's their role. And be very clear and say, okay, the doctor wants to do this, it's going to be requiring this. Again, it's not just a cost shifting exercise, it's a service exercise. So the nurses are spending time explaining to the patients exactly what's going on, why it needs to be done, so they can understand what they're getting at. They're not feeling also awkward. We've all been there where someone's given us a quote and we're a bit awkward, we don't really know what to do, and we sort of just agree and then we sort of kick ourselves later. We don't want that. We don't want people feeling awkward around that. We want people understanding exactly what needs to get done, why it needs to get done, and trusting that we're not going to advise things that aren't needed. Okay, we are advising things that are needed. We're aware of the time constraints of getting procedures done. We're aware of the time off work people need to get to have things done. We're aware of the cost. And again, they're our family. So if people honestly can't afford what we're offering and what we can do, and we can't work with them, sometimes we can't just say, let's just scale back the cost and leave the anaesthetic out. We can't do that. But I think we can certainly go, look, let's get a referral into the hospital as fast as possible so they can then take it from there. And when people are educated around what you're doing and why you're doing it, they will understand. And when people understand what you're up to and where you're coming from, they'll both appreciate it. And again, that's the outcome we want. We treat our patients like our family. I don't want my family to feel like they're in a whirlwind tour in a medical centre and not understanding what's going on. So yeah, big weight off my shoulders was getting that financial discussion out of the consult room and into the people who are better trained at it and enjoy it better and are good at it. And that gives the best service to the clients and to the patients. They understand a whole lot more than me just quickly having a quick discussion.